My name is Maggie. I live in Texas, and I was diagnosed with relapsing MS in 2012. So it's almost been about 10 years now. For me, being a mom it's everything. Any given day, I am getting up with the kids in the morning at 6 a.m. and we're getting breakfast and we're getting our book bags and they're going to school. And then I'm getting ready for my classes. Every day is filled with something new with them, but it's a lot of family time and a lot of me trying to keep up with them. If I wasn't a mom, I don't know if my journey would have been the same when being diagnosed, honestly. They helped me get through a lot of it. I used to work at restaurants. I was a manager. I got pregnant and then I was still working though full time. Like I needed to make money. But things were weird at the end of my pregnancy with my first. I couldn't always stand or I would just start wobbling. We all just blamed it on pregnancy. We didn't know. So we went to a bone doctor and he watched me walk from the waiting room to the exam room. And he looked at me and goes, "Walk back to me." He wants an MRI done of my brain, my spine, lower and upper. I was 22 at the time. So at this point, I'm just like, oh, I do not want to be here all day. That's all I was thinking about. But I did. I got it all done there. And he came back and he said, "Good news. You've got some really good healthy knees. Everything's fine there." I said, "That's great." He said, "But I'm not qualified to tell you this next part. And I'm pretty sure that you have relapsing MS." And our whole world's just dropped. I was angry at that time. I hadn't become the hopeful Maggie yet. I was still the whole why me Maggie. But my mom would not give up. My mom was our main example of you can always be better, keep pushing yourself, keep doing it. A couple months after my mother took me to the college, the community college in town, and I was really confused and I didn't know why she was taking me there. And she goes, "You're gonna sign up for classes for college. You've always wanted to go back." And I said, yeah, I've never even gone. She goes, "That's exactly my point." She said, "You wanna go back to school? We're gonna go to college and you're gonna do this." And I thought she was nuts. She said, "If you have a goal, then you'll keep pushing and you'll keep going until you reach that goal. And so we're going to sign you up right now for classes." And so she wheeled me in and I took my test and I signed up for classes that day. And it's definitely been a long journey, but it really helped. It did help having something, a goal to look forward to and not just focusing on MS. I wouldn't be as far along on the positive side with my journey with this disease if I wouldn't have had her. She's my Wonder Woman. When the doctor told me the different ways that KESIMPTA could help my relapsing MS, I was interested. And then when he was explaining it and then told me that I could take it from home, that I didn't have to go to a doctor's office or to go anywhere to take it, I was sold. I was very interested in it and I was eager to start it. We have this big calendar, so the whole family knows what day that I am taking my KESIMPTA. Having a sensory pen where you know what's going on, you know how long it's supposed to be, you get to visually see the side of it, pull it out of the box, you just twist it, it comes off, needle's already inside. This part right here, it'll turn green when you inject it, it'll click, you'll hear it. With KESIMPTA, I don't have to worry about scheduling an infusion or trying to find a ride to the clinic. Since starting KESIMPTA, I have had fewer relapses, fewer active lesions. The progression of disability it's not there right now. This tattoo is for my MS. So the webbing on it is put together for protection to keep the bad out and no more bad comes in. And then the stone as well, that's what it stands there for, to protect from harm. You'll see the orange is on there, but it's not connected. And I had asked him why he did it like that. He wanted me to always remember that MS was, yes, a part of me, but it didn't define me. I can make this life as much as I want it to be. And I'm sick, and that sucks. But you know what? It doesn't mean that I'm over or that I've ended. My goal is to finish college and to be the best role model that I can be for my kids. I want to be there for them and I want to see them grow up. I honestly see so much more hope now than I did when I first got diagnosed, for sure.
Indication. What is KESIMPTA, ofatumumab injection? KESIMPTA is a prescription medicine used to treat adults with relapsing forms of multiple sclerosis, MS, including clinically isolated syndrome, CIS, relapsing remitting disease, and active secondary progressive disease. It is not known if KESIMPTA is safe or effective in children. Important safety information. Who should not take KESIMPTA? Do not take KESIMPTA if you have an active hepatitis B virus HBV infection, have had an allergic reaction to ofatumumab or life-threatening injection-related reaction to KESIMPTA. What is the most important information I should know about KESIMPTA? KESIMPTA can cause serious side effects such as infections. Serious infections, which can be life-threatening or cause death, can happen during treatment with KESIMPTA. If you have an active infection, your healthcare provider, HCP, should delay your treatment with KESIMPTA until your infection is gone. KESIMPTA taken before or after other medicines that weaken the immune system may increase your risk of getting infections. Tell your HCP right away if you have any infections or get any symptoms including painful and frequent urination, nasal congestion, runny nose, sore throat, fever, chills, cough, or body aches. HBV reactivation. If you have ever had HBV infection, it may become active again during or after treatment with KESIMPTA, reactivation. If this happens, it may cause serious liver problems, including liver failure or death. Before starting KESIMPTA, your HCP will do a blood test to check for HBV. They will also continue to monitor you during and after treatment with KESIMPTA for HBV. Tell your HCP right away if you get worsening tiredness or yellowing of your skin or the white part of your eyes. Progressive multifocal leukoencephalopathy, PML. PML may happen with KESIMPTA. PML is a rare, serious brain infection caused by a virus that may get worse over days or weeks. PML can result in death or severe disability. Tell your HCP right away if you have any new or worsening neurologic signs or symptoms. These may include weakness on one side of your body, loss of coordination in arms and legs, vision problems, changes in thinking and memory, which may lead to confusion and personality changes. Weakened immune system. KESIMPTA taken before or after other medicines that weaken the immune system could increase your risk of getting infections. Before you take KESIMPTA, tell your HCP about all your medical conditions, including if you have or think you have an infection, including HBV or PML, have ever taken, currently take, or plan to take medicines that affect your immune system. These medicines could increase your risk of getting an infection. Have a history of liver problems. Have had a recent vaccination or are scheduled to receive any vaccinations. You should receive any required live or live attenuated vaccines at least 4 weeks before you start treatment with KESIMPTA. You should not receive live or live attenuated vaccines while you are being treated with KESIMPTA and until your HCP tells you that your immune system is no longer weakened. Whenever possible, you should receive any non-live vaccines at least 2 weeks before you start treatment with KESIMPTA. Talk to your HCP about vaccinations for your baby if you used KESIMPTA during your pregnancy. Are pregnant, think that you might be pregnant, or plan to become pregnant. It is not known if KESIMPTA will harm your unborn baby. Females who can become pregnant should use birth control, contraception, during treatment with KESIMPTA and for 6 months after your last treatment. Talk with your HCP about what birth control method is right for you during this time. Are breastfeeding or plan to breastfeed. It is not known if KESIMPTA passes into your breast milk. Talk to your HCP about the best way to feed your baby if you take KESIMPTA. Tell your HCP about all the medicines you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements. How should I use KESIMPTA? See the detailed instructions for use that comes with KESIMPTA for information about how to prepare and inject a dose of KESIMPTA and how to properly throw away, dispose of, used KESIMPTA Senso-Ready pens or pre-filled syringes. Use KESIMPTA exactly as your HCP tells you to use it. Your HCP will show you how to prepare and inject KESIMPTA the right way before you use it for the first time. Do not inject into areas where the skin is tender, bruised, red, scaly, or hard. Avoid areas with moles, scars, or stretch marks. KESIMPTA may cause serious side effects, including injection-related reactions. Injection-related reactions are a common side effect of KESIMPTA. Injecting KESIMPTA can cause injection-related reactions that can happen within 24 hours, 1 day, following the first injections and with later injections. There are 2 kinds of reactions: at or near the injection site. Redness of the skin, swelling, itching, and pain. Talk to your HCP if you have any of these signs and symptoms. That may happen when certain substances are released in your body: fever, headache, pain in the muscles, chills, tiredness, rash, hives, trouble breathing, swelling of the face, eyelids, lips, mouth, tongue and throat, and feeling faint or chest tightness. Contact your HCP right away if you experience any of these signs and symptoms, especially if they become worse or you have new severe signs of reactions after subsequent injections. It could be a sign of an allergic reaction, which can be serious. Low immunoglobulins. KESIMPTA may cause a decrease in some types of antibodies. Your HCP will do blood tests to check your blood immunoglobulin levels. Liver damage. KESIMPTA may cause liver damage. Your HCP will do blood tests to check your liver before you start KESIMPTA and while you take KESIMPTA if needed. Tell your HCP right away if you have any symptoms of liver damage, such as yellowing of the skin and eyes, jaundice, nausea, vomiting, unusual darkening of the urine, feeling tired or weak. The most common side effects of KESIMPTA include upper respiratory tract infection with symptoms such as sore throat and runny nose, and headache. Headache. You are encouraged to report negative side effects of prescription drugs to the FDA. Visit www.fda.gov/medwatch or call 1-800-FDA-1088. Please see full prescribing information, including medication guide, on this site or at www.kesimpta.com.